right, we are talking with Lisa, and Lisa is a respiratory therapist. Lisa, you've worked with Sanford Children's for quite a while, haven't you?
I have for, it'll be 21 years in June, and then I was a student here with the NDSU program for about a year and a half before that.
Oh, wow. So what does Radiothon, raising money for Children's Miracle Network, mean for you?
For the respiratory therapists, mainly it means equipment. We have been able to purchase a lot of specialized equipment that we use with the kids in the neonatal ICU, pediatrics, peds ICU, and the AirMed program. We also go with specialty flights with that as well as well as education needs. So we have been able to go to some different education throughout the United States with all the other hospitals and just hear what they're doing. Oftentimes we find out that we're doing the very same thing, so it's really a nice way to just find out that we're kind of at the leading edge of things.
Wow. And when we were talking earlier, you kind of mentioned some of the extraordinary things that are happening so that patients can stay right here in Fargo and they don't have to go to the cities. Can you tell us a little bit about that too?
Sure. So this year I focused on some of the equipment that we got purchased last year and the year before. One was it's called the Trilogy, and this is actually a home ventilator. Our kids go home with that when they do have those extra respiratory needs. And then this is actually one of our mannequins that we use for education. You can see, looks basically like a normal baby doll, but she has some extra things. She actually has a tracheostomy. So we have had several children who have went home with tracheostomies in the last 2 years, and then they go home with this ventilator. So being able to have the ventilator in the hospital has been really nice because we can get them on it sooner and actually helps to get them home quicker. So we use the baby with the family so they can do teaching. They practice on the baby doll before they actually do the work with their child. So it helps to build confidence in them so they know what they're doing before they have to do the same cares on their babies. So,
can you tell us a little bit about your role here?
Yeah, so I travel all throughout Sanford. I work here at the Children's Hospital. I also work at child and adolescent partial hospitalization, feeding disorders, eating disorders, and then occasionally over at Roger Maris Cancer Center if we have any school-age kids there as well. So I kind of go in and meet with the kid and their parent and decide kind of where they're at educationally and making sure that they're not missing out on school.
What does a typical day look like for you?
I start at behavioral health in the morning, and I go from behavioral health to eating disorders to feeding disorders, and then most of my afternoons are spent here at Sanford Children's.
What does a typical tutoring session look like?
It varies a lot. I do work with kindergarten through seniors, so depending on that patient and that particular day, I guess, it all depends on how they're feeling. You know, being in the hospital, they're not always feeling up to it, so some days it's incorporating a fun game into the learning experience. Some days it's doing, like I said, what their classroom would be doing if they were there, so that they feel like they're not missing out. And then if they are talking to their friends, they can say, you know, I did that too today, so that's really neat.
That is so cool.